Thank you all for joining. Welcome to this year's annual seminar as part of National Farmworker Awareness Week. Our theme for the past few years has just been addressing occupational health issues among agricultural workers with a focus of those who are working here in the United States. And I just wanted to give a little bit of context to the organization that I work with on this is a nonprofit and a student action with farm workers. And they've really created this week of action for both students and community to come together over the years to honor farm workers, their contributions, and to raise awareness about the challenges that they face. And just a quick thank you to our sponsors for this event, who are multiple, including the Post Center, the Johns Hopkins Education and Research Center for Occupational Safety and Health, and then also the Northeast Center for Occupational Health and Safety. And a reminder to everyone that you'll take away from this seminar, but farm workers feed the world, and so that's why we're honoring them here today. I'm going to go ahead and introduce our first of two speakers, and then we'll move on to the next in the second half. But first, we want to welcome Dr. Carly Hyland, who is an assistant professor of cooperative extension in the UC Berkeley School of Public Health in the Division of Environmental Health Sciences. She's conducted her graduate work with the longstanding Chamaco's birth cohort and examined associations between prenatal pesticide exposures and adolescent neurodevelopment. And in her current role as a cooperative extension specialist, she conducts both research and outreach to mitigate the impacts of climate change among agricultural workers. And she uses mixed methods, community-engaged projects on heat, pesticides, wildfire smoke, with the ultimate goal of centering farm workers and community voices to influence policies and actions to improve climate resilience in this essential population. And so without further ado, I'll turn it over to Carly.
Awesome. Thank you so much, Grant. I'll go ahead and share my screen. Yeah, very excited to be here today. Can you all see my full screen?
We see your presenter.
Okay. Let's see. Swap displays. How about that?
Awesome.
Perfect. Yeah, super excited to be here. Yeah, like Grant said, I'm going to talk a little bit about some of the work that I've done on climate change, and really kind of one of the big takeaways that I'm getting from some of this work is like this really key tension between health and economic security for agricultural workers. So I always like to start with just, a little bit of background about why it is that I'm so passionate about the work that I do. And so when I was an undergrad student, I'm from Wisconsin. I went to a really small liberal arts school there. We didn't even have a public health major. I was majoring in environmental science, and I spent a summer in a rural community in Guatemala looking at soil nutrient levels. And, you know, the very first day I went out to the fields with the farm workers, I took this picture on the left where you can see, you know, they're carrying and we're applying pesticides really with no protective equipment. And they would tell me that they felt physically ill after applying pesticides, but didn't feel like they had access to resources and information to decrease their reliance on pesticides, and would also talk about how hot it was and how it was difficult to, you know, wear any more protective equipment. And that's really when it clicked for me, like, oh, I'm really interested in farm worker health and looking at these impacts, not just from an environmental science perspective, but really a public health perspective. And so fast forward, as Grant mentioned, I did my graduate training at Berkeley, mostly looking at the health effects of prenatal pesticide exposure. And I'm not going to talk about that much today, but I will be talking about some work that I did during my postdoc in Idaho at Boise State, and then as well as work that I've been doing since coming back to Berkeley as an assistant professor, really focused on kind of the interconnections of all of these climate intensified exposures and impacts on farm worker health. So just to frame this a little bit, you know, it's probably not surprising to a lot of you here that farm workers are one of the groups most disproportionately impacted by the impacts of climate change. So just in part, you know, they have a really physically demanding occupation that's often outdoors, often with limited implementation of, you know, engineering and administrative controls to protect against some of these exposures. And we know that at baseline, they have, co-exposure to various different chemical, physical, and biological, exposures. And a lot of these are amplified by psychosocial threats to health, which are only continuing to worsen with the current federal administration. Many farm workers have limited access to health and legal resources, to address any exposures or health impacts experienced at work. And there's really lack of, federal standards to protect farm workers. Some states have, heat standards or smoke standards, but there's also pretty poor enforcement of those existing regulations. And so you can see, for example, this screenshot from a title of an article in Inside Climate News about how, even though California is one of the states with the most protective heat standards for farm workers, there's still really poor enforcement of those regulations. And so there's still high levels of, unfortunately, morbidity and mortality, even in one of the states with the strictest regulations. And so I'm going to talk a little bit first about some work that I did as a postdoctoral scholar at Boise State University. So again, my background was really mostly in pesticides, and I was doing some research understanding kind of differences in pesticide exposure between men and women farm workers and farm workers' perceptions of pesticide risk. And one of the things that I was really hearing over and over again is what we're most concerned about is heat. And so I kind of started another project looking at kind of farm workers' perceptions of climate change and impacts on their health. And one of the things that really came up over and over again was just how oppressive the heat was and how it was really difficult to combat the effects of heat. So you can see, this person saying, the sun affects us when it's about noon. You don't want to be out there anymore because it's getting hotter and you can't take it, but you have to be there working your hours because of your needs. And then you can see some other quotes from another person really highlighting they get one paid 15-minute breaks and they could decide to take additional breaks if they wanted to, but many people aren't going to do that because they're not paid and they just want to keep working. And another thing that's important to keep in mind is that many of these individuals are paid like piece rate or by how much they're producing. And so there's really kind of this incentive to keep working as hard as possible and produce as much as possible, even under, these extreme climate scenarios. And then something else that was really coming up a lot was kind of this conflict in protecting yourself from heat and protecting yourself from pesticides. So, the best, I wouldn't say the best, the most common messages farm workers hear to protect themselves from pesticides is to wear more protective equipment, but that also really increases the short-term risk of heat stress. And so you can see some participants saying, when it's hot outside, I tend to wear the least PPE for the heat. I only use a sweater because if I put on more layers, I start sweating so much, I feel suffocated. And then, kind of a similar quote from someone saying, we don't wear masks because of the temperatures in the sun. And as I said, this is really all kind of underscored by lack of access to health and social and legal services. So again, you can see some participants talking about how it would be great if we had access to health insurance. And this person saying, so when we feel sick, instead of complaining and being like, you know what, I've had a stomach ache for days, let me go check it out, but I'm still here because I need the money. I can't afford the doctor visit. The doctor visit is going to be more costly than me coming here and working and possibly fainting. And then you can also see, hesitation for kind of common routine care, such as getting vaccinations or other things like that, because it's all out of pocket. And so, I was coming out of my postdoc and becoming a lot more interested in looking at kind of these interconnected impacts of climate change and realizing we really can't just be looking at pesticides and heat and smoke separately. We have to understand the full story. And at the same time, this really amazing position came up with the Cooperative Extension in California. And so I've been back here for almost 2 years. And like Grant was saying, my position is really focused on doing both research and outreach to mitigate the impacts of climate change among farm workers. And I'm just going to talk a little bit today about one of the big projects I've been doing with that, looking at farm workers' experiences working during wildfires in Sonoma County. And so, as a bit of framing, I think when a lot of people think of Sonoma County, it's this really idyllic location in Northern California where you can go wine tasting. There's some areas right on the coast. It's a really nice, like vacation spot and a really big tourist destination. But the other side of that is that like this entire economy is really propped up by farm workers. And Sonoma County has also experienced really between 2017 and 2020, it was like every year was, the new biggest record-breaking wildfire. Of course, since then, those records have continued to be broken. But there have been really, really destructive wildfires, and we know that those have had disproportionate impacts on farm workers who often have to continue working in really dangerous conditions. And so I've been doing a project in collaboration with the Human Rights Center, which is a research group out of the law school at Berkeley, really looking at farm workers' experiences working during wildfires, and in particular, looking at health, physical safety, and economic security. And so as part of this project, we worked with a local community engagement team and surveyed over 1,000 farm workers and looked at like their experiences working during wildfires, what types of resources and training they're getting and what types of resources and training they would like to get about how to protect themselves from wildfires and who they would trust to interact with to get that information, and then also economic concerns. And I really just want to highlight the incredible community engagement team who really led a lot of this effort on the ground, and in particular, Zeke Guzman, who you can see in the picture on the right there, who's a local farm worker advocate. And it was really him who had the idea of hiring this community engagement team and working with them to recruit farm workers since they're trusted individuals in the community. And so then briefly, just looking at some of the findings from this work. So we saw that 75% of the, just over 1,000 participants had worked during a wildfire, and many of those had experienced short-term health impacts such as a headache, sore throat, persistent cough, and eye irritation. And almost everybody said that they were concerned about the health effects of wildfire smoke if they were to be working in a wildfire moving forward. And we also saw a lot of barriers to accessing health services. So over 50% of the population didn't have health insurance. And something else that came up a lot is that, the clinics are often open from 9 to 5 when farm workers are working. And, just like we heard in the work that I presented from Idaho, if individuals have to choose between, going to work and getting paid, or taking time off work and going to the doctor and often having to pay out of pocket, a lot of times farm workers feel like it's really necessary to keep working. And so you can see a couple quotes from participants in this study here, which I think are really similar to what we heard in the work in Idaho, where they're saying, we don't have enough money to pay expensive medical bills. At the end of the day, I don't have a lot of money to pay a doctor. And this person saying, sometimes we just have to toughen up because we don't have enough money to pay for the medicine. And again, as Grant outlined really well at the start of all of this, like these are the people who are growing the food that we all eat. And then I think the most clear kind of finding from this work is this very high level of tension between economic security and health. And so at baseline, we found that 74% of the population was spending between 50 and 75% of their monthly income on rent. The recommendation is that you're spending about 1/3 of your income on rent. And so this is just showing like at baseline, so much of their monthly paycheck is going to just keeping themselves housed. And so then if there's a wildfire and they can't work, there's just such a high level of concern about being able to pay for basic needs. And we saw that over 50% of the population who had worked during a wildfire said that they continued, they felt sick, but continued working either because they were afraid of losing income or they were afraid of losing their job. And specifically, we found that, if there were wildfire and participants couldn't work, 98% said it would be really difficult to be able to pay for rent. 83% said groceries, etc. And you can see, some of these things like medicine and healthcare are a little bit lower. But as we saw from some of the quotes earlier, I think a lot of that is because those are already kind of secondary things that farm workers in this population were concerned about, because things like being able to pay for rent and groceries were just so much more immediate and so much more top of mind. And, these are also very significant contributors to health. And kind of digging into this a little bit more, we saw, some folks saying, like, talking about this tension between having to work in potentially hazardous conditions. They were saying, we bring in money for the household to pay for the bills. We have to work to be able to pay for rent or else we get evicted. Those talking about being in debt. Some people were talking about how, this had happened last time, like in previous fires, and with their hours being decreased, it was really hard to sustain themselves. And then I think this quote was really powerful with, to be honest, it is very hard to stop work, even if we were in danger because of the wildfires or the smoke or bad air quality. We still have to work. We do not have any other form of income. And I think something else that's really important to keep in mind is that agriculture is already pretty seasonal in Sonoma. The winter is already, a time when not a lot of individuals have work. And we're seeing that with the increasing impacts of climate change, not just fires and heat, but also increasing flooding, that workers are getting a lot less work opportunities. And it's just, like at baseline, becoming a lot more difficult to meet basic needs. And Zeke, the farm worker advocate I work with, has been having kind of different house meetings where he'll talk with, farm workers and bring in like 10 to 12 farm worker families and kind of listen to their concerns and understand what's top of mind for them right now. And one of the things that's coming up is it's so difficult to find other forms of employment, particularly during the winter. And there's just like this really high level of economic insecurity in this population right now. And so then I just wanted to briefly highlight some other kind of ongoing and upcoming efforts. So I'll have a project coming up in collaboration with the Public Health Institute, which is a really big nonprofit based here in California, looking at extreme heat resilience in the Central Valley. And so my part of that project is this summer we'll be doing some surveys and interviews with farm workers to get their ideas of interventions to mitigate heat stress. And then next summer we'll be doing a small pilot study in which we'll, test the impacts of those farm worker informed interventions on reducing heat stress at the workplace. One of the really big things to come out of this project in Sonoma County is the need for a farm worker resource center and kind of like a one-stop place where farm workers can go to get information about all types of, whether it be occupational concerns or how to file a complaint, as well as information about like health resources. Some of the things that we've heard in these farm worker meetings are like, I need assistance in how to file taxes and things like that. And just having like one place where individuals can go to get this information. I'm also trying to learn more about how to get like out of the traditional academic sphere and do more in terms of publishing like op-eds and commentaries and white papers. You can see in the upper right-hand corner, I'm part of a fellowship with a group of other like healthcare providers and researchers and farm worker advocates. And one of the things that we're looking at is how current pesticide regulations really are not protecting farm workers from these co-exposures with heat. As I presented a little bit here, like farm workers are a lot less likely to wear PPE when there's really high heat. There's also some evidence that certain pesticides volatilize more quickly with heat. And so we're trying to see like, what can we do to protect farm workers from these co-exposures? And then also thinking about like, how does all of this work inform potential legislation? And I really think like the big thing that I've come away with from some of these projects is like, we need economic models like disaster pay, where farm workers can continue to get paid when it's too dangerous to be working outside, whether it be during wildfires or heat waves, et cetera. And just want to really like give a shout out to the incredible work from the Safety Net for All Coalition in California. This is a coalition that's working towards expanding unemployment insurance to undocumented workers. This isn't quite exactly the same as disaster pay, but would still do a lot to, get at some of the issues that I've highlighted here today. In the last legislative session, they had put together a really impressive bill, which got watered down to a study bill that would have just essentially studied the ability for a California department to administer a program like this, and wouldn't have actually like provided unemployment insurance to any workers. And unfortunately, Gavin Newsom even vetoed that bill. And so I think it's just really important to highlight that, like, in California, which is theoretically, like providing the greatest protections for farm workers, we are still really, really far from where we need to be in terms of actually making sure that there are like systems level solutions to protect workers, both in terms of, the actual programs on the ground and again, enforcement of current regulations. And then, yeah, just briefly want to acknowledge the really incredible team and students that I get to work with and some of the funding that has supported this work. And I will, just briefly show this, and I'll put my email in the chat, but really happy to talk about this and engage at any time. I actually am hoping to hire a postdoc soon, so if you know anybody who might be interested in this type of work, please let me know.
Awesome. Thank you so much for the presentation. We can take questions for a couple minutes if anyone wants to come off of mute and ask or put a question in the chat. Feel free. Go ahead, Michael.
Thank you. I wanted to ask what kind of percent of the workers are migrant workers that because housing is such a big percentage, I'm wondering if those are people that just live in the area, or do the migrant workers have any housing that's provided for them, like inexpensive housing where they can just live while they're working there before they move on to the next place? And as a corollary question, you mentioned like the access to healthcare, like they're working 9 to 5, but with the heat, don't they start like at the crack of dawn and work till noon, or and have breaks? Or so those two questions.
Yeah, really good points. In terms of the type of workers, it's a little bit of a multifaceted answer. One is that there is a good proportion of agricultural workers in California and other states who are working under the H-2A visa program. So this is a seasonal visa where they can come to work in the United States, usually about 6 to 9 months, kind of depends on the exact farm and location. And then they have to go back home. Really, the program is almost predominantly from Mexico, and so they have to go back during the off season. One thing that's important to note is this work in Sonoma, even with the community engagement team, and we were not collecting any identifying information. We weren't even asking names. We got permission to just do verbal assent rather than written assent. Our community engagement team had contact with H-2A farm workers, and not a single person would participate in the study because they were so concerned about fear of retaliation from their employers. Most of these individuals are living in Sonoma year round, though there is still some kind of migration like to the Central Valley and back, especially with, more work there over the winter. But something else I just want to note is like, I have never in studies that I've done asked specifically about documentation status. And at this point, I'm not even asking about country of birth anymore, just because I think there's so much fear with the current federal administration. And then in terms of healthcare access, it's true that, and this is still a little bit regional in California, that in some areas work schedules are shifting quite a bit, particularly in the Central Valley. However, there's still a lot of issues with a lot of this work is done in very rural, remote areas. A lot of folks don't have transportation. Like I did another project looking specifically at pesticide exposure among pregnant farm workers and lack of access to prenatal care in that population. And, we were seeing that folks are walking miles to get to a handful of prenatal care visits. And so there's just still a lot of challenges, even if the clinics were open, more regularly. Like there's a lot of disconnects in folks in this population accessing that care. Great questions.
And then, Crystal, I'm not sure if you wanted to mention your comments, but in the chat, it's there.
Sure, I'll say thank you for a great presentation. I'm a practicing industrial hygienist, so this was all very near and dear to me. So what I put in the chat is that the American Industrial Hygiene Association, AIHA, has done a lot very lately with heat and wildfire smoke both. I was just curious if you'd had any chance to link up with them and maybe collaborate.
I haven't specifically, but that's a really good suggestion. And I know that there were comment periods this last fall, mostly for federal, both heat standards and smoke standards. And I did provide comments for those. We'll see where that goes at this point.
Okay. And they also have an active government affairs section, so they might be able to help, with any lobbying efforts that you have going.
Awesome. Thank you.
Thank you.
Awesome. Any final question for Carly? Feel free to put them in the chat, and her email address is in there as well. I know I'll have one quick question. I know that some of this work is upcoming, but do you have a sense on any of the potential solutions or mitigation strategies that might come out of the future work that you're planning to do for heat and housing and smoke?
Yeah, it's a good question. And I think in general, my message is we need to move away from kind of the individual level behavioral and educational interventions. I think a lot of times people are quick to say, we need more education for farm workers, or like they are well aware of the impacts of climate change, probably more than any of us in this conversation. And I think like the focus on kind of individual level behavioral interventions is not really getting at the root of a lot of these problems. And so, for example, it's pretty clear that for heat stress, like the biggest predictor of heat stress is your internal body temperature, which is, impacted by how hard you're working. And so like more breaks and more frequent breaks is really kind of like one of the key answers to that, not just drinking more water, for example.
Awesome. Thank you so much.
Yeah.
We'll move on to our second speaker now, who I'll introduce. And so we have Farah Arosemena-Murfee, who's the program manager of the CDC and NIOSH-funded Southeastern Coastal Center for Agricultural Health and Safety, based at the University of Florida. And she's also the director of their pilot and feasibility program. In her position, she serves as an integral part of the center's efforts to develop, connect, and leverage active research and broaden capacity building initiatives in environmental health for Southeast US and Caribbean communities. And her research interests include exploring the biopsychosocial aspects of disease, the roles that disaster and occupation, including agricultural work, have on health and quality of life, and then also the implementation of interventions to augment local healthcare systems with holistic, homegrown, community-informed, and culturally tailored programs. And the slides look great. But you are on mute. Sorry.
Can you hear me now?
Yep, sounds great.
Thank you for the invitation to speak today. What I want to share with this group is the importance of maintaining health surveillance efforts during a time of swift moving policy and government actions. The noise can be distracting, and at the Southeastern Coastal Center for Agricultural Health and Safety, we are finding new ways to collect data, cultivate our outreach, and hopefully inform policy so we can keep our agricultural, occupational health and safety work continuing. Now, being located in Florida certainly gives us a springboard into pivoting research methods. We had some very early policy changes that included diversity, equity, inclusion policies that were changed here at the University of Florida, which is a state-funded institution. And we had immigration orders here as well, immigration policy, Senate bills. So amidst all of the new executive orders related to immigration, we definitely had a little bit of a head start in modifying how we look at things and how we can protect our populations who were participating in human subjects research, but still we remain very much impacted. So I will just start off with the very first thing that hit us, and that was the Florida Senate Bill 1718. This was Florida immigration law. It was in response to Biden's border crisis, and the Florida governor approved this on May 10th, 2023. So now we're in 2025. So just to give you an idea that we've been doing that, we've been dealing with this for a while, knowing that this was going to come on. So from May 10th, when this was approved, to when it was implemented, we had to swiftly move some of our projects out of field study just to comply with the law. Now, this was creating penalties for employers who were knowingly employing unauthorized aliens, was the language, so unauthorized workers. We do compensate human subjects research. So it left this shade of gray as to whether students who were working in the fields collecting data, faculty, our postdocs, if they were to encounter any issues with authorities, sheriff departments, deputies coming on to agricultural properties and implementing Senate Bill 1718, they certainly had a right to. The Senate bill also required that any hospital that accepts Medicaid, that they inquire about a patient's United States citizenship. We do have a project that looks at electronic health records coming in from various federally qualified health centers, which of course accept Medicaid and are affiliated with our regional hospitals. So that became a major issue for us as well. In looking at those medical notes, what did that mean for us? So this gives you a better visual of how swift the Florida policy was. In September 2022, many of you may have made national news when our governor sent migrants on a flight to Martha's Vineyard and kind of left them stranded there. We then heard a lot of talk in the press about the Biden border crisis, and in response to that, Governor DeSantis really used this during his presidential campaign, and it definitely picked up. And so he was able to very swiftly sign SB 1718 into law. And then came his suspending the presidential campaign, but the push on immigration here didn't stop for Florida. He then deployed the Florida National Guard to the US-Mexico border to stop the invasion and had a series of press conferences. So if you are a farm worker and you are seeing this in the press, you become a little nervous to participate in research. And so even though the federal district court at least put a preliminary injunction that halted enforcement of Section 10, which was the transportation part, you weren't allowed to transport migrants to work, for instance. So this became a big problem for ag industry in our state. So, but even though the federal district court was, halting some of these things, the message was out there, and it was becoming a little scary for ag workers to participate in research. To compounding this now is the immigration executive orders. And here are just two. There are more, but here are just two. And these are for national security measures. And they can authorize a state and local law enforcement officials to investigate, apprehend, and detain unauthorized or who they perceive as unauthorized workers. So there's a lot of room for profiling here, especially in states like Texas and Florida, where we have Georgia, where we have larger ag worker populations, California. This also is, I mean, I don't have a crystal ball. I wish I did. And I wish I knew exactly how this was going to impact folks. But in, California, Florida, Georgia, we have very large populations of H-2A workers. And those H-2A workers need visas. And so these immigration executive orders, we don't know how that's going to halt or delay those applications from coming through. And our farm workers really rely on those seasonal workers. Even though they need year-round workers, they do rely on those applications to be approved and that for those workers to be allowed to come in and work legally on their farms. So we don't know how that's going to play out. Now, these executive orders are pending litigation, but I want to caution folks always that we should expect them to remain over the next 4 years. Again, another visual just to show you a timeline of how swiftly these all were implemented. Election day was in, November 4th. We headed over to the inauguration in January, and the executive orders were signed in January for the immigration executive orders. Now, there's something that hasn't been talked about much, but during the Biden administration, we had safe mobility offices across Latin America that were supposed to be helpful in giving people a way to learn more about how they could legally come to the United States. It was never clear if these SMOs or these safe mobility offices would streamline assistance for prospective ag workers outside the United States. But we had hoped that they would. These have all been shut down. So they mostly served as an education venue, and they weren't accessible to everyone. But it was a start. It was a stepping stone, maybe in the right direction here to reform some issues that we were having with the worker visas. There is no specific executive order directly impacting H-2A or H-2B visa programs. But I don't have the crystal ball, but we're still waiting to see how this all plays out. Now, implications on the ag industry. I think this is really important just to go back. I know many of you may know this already, but 80% of U.S. ag workers are foreign-born, many coming from Mexico. 300,000 of these workers are using the H-2A visa program, but approximately 850,000 are unauthorized. Project 2025, which is the implementation program for the new Trump administration, has recommended that H-2A visas be phased out and that the U.S. subsidized mechanization. Nothing has been decided yet, but we know this was a recommendation coming through. And we also know that there are issues with mechanization, right? So farmers and ranchers have extensive workforce need year-round. Unauthorized workers outnumber H-2A visa holders, and they are leaving. So we don't have a backup plan. We don't have a backup plan to replace those workers who are leaving. And so there's difficulty hiring that we can anticipate. We don't know the future of the H-2A program. The cost of H-2As is already very, very high. So we haven't seen it quite yet, but the ag industry lobbying firms will probably start pushing back on this a little bit. it's going to be, their needs contradict the immigration executive orders, however. So we don't know how this is going to play out for our ag industry. So for Florida, I discussed this during the ISES conference last year in 2024 in November. But for Florida, we have about 200,000 migrant and seasonal farm workers. And I think we outnumber all states for the certified H-2A workers that we have in this state. But before the new administration and with Senate Bill 1718, just in Florida, we already saw a drop in these numbers. Farmers were reporting that farm workers did not want to come to Florida. They were too nervous. To give you sort of a visual, Florida doesn't have a border with Mexico, but even in the interior of our state, we had immigration ICE vehicles dotting I-75, which goes down the middle of our state. Really not necessary. It was threatening, but it made everyone very nervous. And it was very displaced of Florida. I've seen this in other states, but never in Florida that were bordering the Mexico border. So we're worried about interior enforcement. Exploitation is already an issue with substandard housing and discrimination. And then, of course, lower adherence to medical care, now not wanting to go to our migrant health centers, our federally qualified health centers, or emergency rooms for care. And then something I want to discuss, let me go back to this slide. I want to discuss on March 1st, there was an immediate expansion of American timber production executive order. So know that that's here on the timeline. And now I'm going to talk about, those are H-2B workers, visa workers that typically are hired for that unless you have forestry work on a farm where you then could be an H-2A worker. But with this expansion of American timber production, we are going to need more workers. And so one of the things our center is looking at, what does that mean? How are these forestry workers in North Carolina, South Carolina, going to be impacted if they have to rapidly shift and start moving into this industry because there's a need and they need jobs and they want a paycheck? Is there timing for safety training? Is the investment in protective gear ready to go for these workers? Also, you think about it from an environmental health perspective, forests protect the environment. They protect from flooding. We know that North Carolina just had catastrophic flooding. So using that region for timber is concerning. So academic industry community partnerships are what make our center run. Without them, we would get nothing done and we'd have no impact. But state policy and executive orders have created uncertainty in participating in these center activities. Community-based organizations are focusing more on justice initiatives, and industry is less interested in supporting research protocols on site. So we have partnered with ag industry, with even small farms, and they're just saying they're not comfortable having us on site or calling attention to their workers. And farm workers are beginning not to trust participation in our protocols. We'll skip this slide. So that being said, new approaches with less burden on the community needed to be employed. And we were lucky. We had some investigators here who were involved in wastewater epidemiology, air quality surveillance, and taking a deeper dive into electronic health records where we could have a little bit more control of what we saw. So we didn't have to report anything should that section of Senate Bill 1718 be implemented. The wastewater epidemiology was led by Dr. Sabo Atwood. She is our deputy director. She's actually now the dean at the Arnold School of Public Health at the University of South Carolina, but still our deputy director. But she's moving a lot of these initiatives to those Atlantic states that remain in our Southeast region. This was a surveillance tool implementation, and it started with the COVID pandemic. So, having a year and a half off, she decided to head out into the field with a multidisciplinary team of research microbiologists, aquatic toxicologists, analytic chemists, environmental engineers, and small business partners who would let us on their properties to take these samples. And these were used to examine current limitations of community wastewater measurements for various biological and chemical markers. Again, COVID started this, but then we realized, wow, this could be a way for us to look at, for example, like drug use in these communities, and analyzing the water, the wastewater that was collected for those markers, and other infectious diseases. And so that was an approach brought to us by Dr. Sabo Atwood, and it was called Gator Watch. Air quality surveillance, we had the opportunity to submit a supplement for a CDC U54 grant. And now he's a doctor, but he was a graduate student at the time. But Drs. Andres Manrique and Tara Sabo Atwood put together this supplement to measure air quality in larger ag communities. So they have put up 19 monitors that continue to collect data. They partnered with Redlands Christian Migrant Association, which had multiple sites across South Florida. And so they were able to put up the Purple Air low-cost air quality sensors at their facilities, which are fence line communities to big industry farm areas. Electronic health records was led by Drs. Yi Guo and Norman Beatty. And we here at Florida, we have One Florida Plus clinical research network. And the Data Trust is a system that utilizes big data sets to create a computable phenotype to analyze for them. It can analyze anything you really want it to at a cost, but they were looking at kidney disease within agricultural regions. So stakeholder engaged research in partnership with Florida federally qualified health centers. So not collecting data directly from human subjects, but going to the EHR, seeing if they identify as a farm worker, and then looking to look for kidney disease and other markers in this population. And then post-hurricane data surveillance, post-storm data surveillance is something that NIOSH really wanted. So the National CDC's National Institute for Occupational Health and Safety. And so we maintain a housing database here at the center. And so we know where all the farm workers reside. And we monitor these housing sites are assessed monthly, it depends. And so we definitely thought it was important to keep looking at those inspection reports. And so that's what started us keeping that data set going. But it became really useful post-Hurricane Katrina. I mean, not Katrina, post the past two hurricanes here in South Florida. And so we were using this database of Florida farm worker housing sites and prioritizing them by mandatory evacuation zones and flood zone types to identify the most vulnerable populations and provide disaster preparedness and recovery outreach to those folks. So NIOSH could better target where to send their teams to. So we've been able to use that as well. And strategic planning to continue addressing the burden and need of our workers. Surveillance is critical. And we don't want to stop that. We know our human subject data collection is slowing down. And so we are pivoting. Prioritizing surveillance has been successful in not placing stress on our communities during times of uncertainty. We can continue to understand disease patterns, identify emerging health threats, and inform public health interventions for the benefit of Florida ag worker communities. And then new things that we're thinking about, really, trying our best to be bipartisan, is to look at food as medicine funding opportunities and working with the farm industry and really using that to promote what, we need farmers here. I mean, Grant, you said early on that, farm workers feed the world. I think it was your quote when we started this, and they do. And so looking at grant opportunities that focus on food as medicine. This is not new to this administration. This has been something that's been going on since 2021, 2022. There was a food as medicine office started, but the HHS is really promoting this now. And so I think the smart thing to do is to be in that mix, to be in the conversation, and to try to be in the room where those discussions happen, and make sure that's a way for us to promote the importance of ag workers in our country, and the importance of keeping them healthy and safe. That's it. I want to acknowledge the director of our Southeastern Coastal Center for Agricultural Health and Safety is Dr. Glenn Morris, and the research corps investigators who designed the approaches I discussed, Dr. Tara Sabo-Atwood, Yi Kuo, Norman Beatty, and Andres Manrique. And that's all.
Thank you so much for another great presentation. Again, we have a few minutes left for questions at this time. Feel free to come off of mute or put any questions in the chat. I have a question that I can start with, and I think this was part of our other conversation, Farah, but how have any of the changes federally started to impact the agricultural product in Florida and like where it can go? And is there any sense of addressing food insecurity within the United States?
Yes, so that's a big deal in Florida. We have silos of food that will waste away. When USAID was cut, Florida farm workers participate in that program. And so I don't know the answer. We're trying to get more of a grasp on what has happened with those products, but they could not be shipped. I do know that. That was a problem across the country, and some states handled it a little differently. It has not been published here where the food went, if it went to food banks, if it.
And there's I think, similar related question in the chat from Matt. Do you have an idea of the state's economic impact as a result of the policies that you have discussed in today's presentation?
Not yet, but we do, we are working, or actually center-wide, it was discussed at the recent meeting in Washington, D.C., that we have an economist on here helping us understand the economic impact. And I fully agree, it's so important. So that is a priority.
And there's one more comment and question in the chat. I'm not sure if, Alexander, if you want to come off mute or I can read it out loud. Go ahead.
Absolutely. Thank you.
Oh,
That was such a wonderful presentation. I learned so much. That was so wonderful. I was just wondering if you could talk a little bit about this idea of kind of growing mistrust among certain farm working communities around like, research participation. I thought that was a really interesting point, and I'd love to learn more about how you're seeing that manifest. But you also talked a little bit about data in regards to kind of migrant health centers, and I was just wondering if there's any like tensions or changes that you're seeing like emerge from this exchange between change and like I'm sorry, it's kind of a couple of different ideas at once, but I was just wondering if you're seeing any interactions between these two parts of your research.
Well, I'll say about the trust piece, it started out, we had a group going out in the field that had such strong ethos. And at the time, there were 2 graduate students. They were mentored by Dr. Sabo Atwood, who's our deputy director, and they saw nothing. I think that their participants they reported were willing to tell them anything. It was us who got so nervous at this, us in academia. We're like, no, we don't want to put them in jeopardy. We don't want to put students in jeopardy. We're really nervous about how this is going to play out. So it started pretty fair. And we were like, okay, well, we still have to pull back a little bit. But it's great that we've established, or this one team had established so much trust with their cohort that they were going to stick through it. And then as we started talking to industry partners, they really were like, hey, you can't come on the farm. It was mostly bigger business, less of the small farms and more of the big industry partners that we were working with. And so we understood that, and we're like, yep, we understand that. That's difficult. I think where it took about, I would say, 7 months, but when the press conferences started happening in Florida, the Stop the Invasion, our governor would stand in front of a sign that was huge, and it said "Stop the Invasion" on it, and behind him would be a large group of deputies. And he would talk about immigration. And I think in my ISES presentation, I did have that photo. I took it out of this presentation. I don't want to put a target on anyone's back. But anyway, that's when we started to get a little bit more feedback on like, hey, I think for now, maybe participating in the human subject stuff isn't the smartest thing to do or the safest thing to do. But in the beginning, it was... there was a lot of trust, but that was because we had one group that had already created all of these like strong connections in South Florida. I'm curious to know if we go back into those communities, I'll ask those investigators like what they would say. But it is important. We should do a surveillance project. We should do a survey project on that. Now, your second question was migrant health centers. It's really funny. I don't know anyone that is reporting. We're not seeing, if you're referring to having to report their status, if a patient comes in to a medical facility and lets the physician know that they are undocumented or unauthorized, that doctor now has to report that, was what the Senate Bill 1718 was mandating. I don't know of any physician who has done that to date. I haven't heard, none of the physicians we work with even talk about it. So it hasn't, if that's your question, that hasn't become a problem.
Absolutely.
And we have, in other states I have read, and I was on a webinar a few weeks ago where there were issues in some states where there were deputy officers parked outside of migrant health centers, but I have not heard those reports here.
That completely answers my question. Thank you so much.
In the interest of time, since we are at 1 p.m., I just want to give another thank you to both of our speakers. Thank you so much for the awesome presentations today. For everyone who registered to attend this event on Zoom, we'll share the contact information afterwards if you would like to keep the conversation going. Thank you to everyone here today.
And thanks to Grant and Keith for making all of this happen as usual. So thank you all. Great to have this.
Thank you, Carly. Thank you, Farah.